Welcome to a debate for Town of Winchester Board of Health, sponsored by the League of Women Voters of Winchester. This debate will be followed this evening by a debate for the school committee. My name is Lynn Brodsky. It is my pleasure to represent the League of Women Voters of Winchester as we bring you this evening's event. Thank you to WinCam for hosting the Zoom format of this event and for broadcasting and streaming it to the public over local cable TV channels and the WinCam website, respectively. The League of Women Voters is a nonpartisan organization with a mission to promote informed participation by all eligible voters and public understanding of major policy issues. We do not support or oppose any candidates or political parties. We do study and take positions about major policy issues. We are organized at the national, state, and local levels. Our policy positions and activities can be reviewed on the respective websites. If this forum and our mission meet your needs or even inspire you, we encourage you to donate or become a member. All people may join. Student membership is free. This year, there are contested seats on 4 townwide boards, and these are the subjects of 2 debates this evening and 2 debates the evening of Thursday, March 10th. All candidates who are debating this week, the candidates who are running unopposed, and many of the candidates for town meeting have generously provided the league with information about themselves and about their candidacies. You may find these candidate profiles on our website at lwvwinchester.org. Thank you, candidates, for submitting your profiles to the league. This evening's debate will be moderated by Mary O'Connor. Mary is a trained league moderator and a member of the League of Women Voters of Cape Cod area. Mary?
Thank you, Lynn. Good evening. The candidates running for Board of Health are Ruth Trimarchi and Jen Inferna, who are running against each other for a 3-year position, and Gregory Sawicki and Lauren Costello, who are running against each other for a 1-year position. The rules for the debate are as follows. Each candidate will have up to 90 seconds for an opening statement. The order of speaking was determined ahead of time by random method. After opening statements, I will ask the candidates a series of prepared questions in rotating order. Each candidate will have up to 90 seconds for each answer. After each set of answers, the candidates or I may request a rebuttal. Should a candidate choose to rebut, the candidate will have up to 30 seconds to do so. I may, on occasion, allow a second round of rebuttals or ask a follow-up question, depending on how the discussion has gone. Personal references about other candidates are out of order. After our final question, each candidate will have up to 60 seconds for a closing statement. The closing statements will be given in reverse order from the opening statements. We will now start with opening statements of up to 90 seconds each. The order we will go in is Gregory Sawicki, followed by Jen Inferna, then Ruth Trimarchi, and Lauren Costello. Gregory.
Good evening, and thank you to the League of Women Voters for organizing tonight's debate. My name is Dr. Greg Sawicki. I'm a doctor, a specialist in childhood lung disease, a public health researcher, and a parent to 2 young children. I have lived and worked in the greater Boston area for nearly 30 years, and I'm now delighted to call Winchester home. As a pediatrician, promoting the health and well-being of children and their families is a lifelong mission of mine. My day-to-day work focuses on building trust with families, counseling children, teens, and caregivers, developing actionable solutions to treat some of our most vulnerable youth, and working collaboratively within multidisciplinary care teams to provide the highest quality healthcare to all who need it. The pandemic, as we know over the past 2 years, has placed health concerns at the center of nearly all of our lives, affecting our homes, our families, our relationships, our schools, workplaces, and most of our daily routines. Thankfully, because of incredible advances in science and medicine, we are now entering a new phase of this pandemic with proven mitigation strategies treatments, and vaccines. The Board of Health has to promote a collective community responsibility to protect the health of all our residents. I'm running for the board specifically to work with leaders, departments, and organizations as we enter this phase. And I really believe our community needs new, experienced voices at the table to advocate for our population for science-driven, data-driven decision-making. I look forward to our discussions.
Thank you. Jen.
Good evening, and thank you for hosting this debate tonight. My name is Jennifer Inferna, and I'm a 16-year resident of Winchester. I have a master's degree in public health and over 20 years of experience working in public health and healthcare in the public and private sectors. I have worked at all levels of government in public health. I've worked at the Massachusetts Department of Public Health and Infectious Diseases. I've worked for the state legislature as research director for the Joint Committee on Public Health, where I analyzed health policies and laws for the entire state of Massachusetts. I've worked at the U.S. Department of Health and Human Services, implementing the Affordable Care Act across the 6 New England states. And I now am a sitting member of the Winchester Board of Health, having been appointed by the Select Board and Board of Health this past December. I've also held multiple leadership roles at Mass General Brigham in finance, negotiating health insurance contracts, in operations as chief of staff to the chief operating officer, and tracking healthcare laws and legislation for the entire hospital system. I bring a strong understanding of government and how it works, having worked in public health at all levels of government. And in my health policy experience and health finance experience, I've had to sift through complex information, state and federal regulations, contract terms, and analytics, filtering for relevant information, asking the right questions, and working with others to develop solutions. These are the strengths that I would bring to the Winchester Board of Health, and I ask for your vote so that I can leverage these skills and experiences to improve the health of Winchester. Thank you for your vote.
Thank you. Ruth.
Good evening. Thank you to the League of Women Voters and to our listening public. I'm Ruth Trimarchi. This is an exciting time to serve on the Board of Health. When elected, I will bring a reasoned, science-based voice to board decisions, extensive local experience on environmental issues and their health impacts, and a track record of fostering communications in my strong civic participation in Winchester. I grew up in Adams, Massachusetts, the 8th of 9 children. After raising our 2 children in Amherst, my husband's work in biotechnology brought us to Boston. We chose Winchester to live in because of its enviable location, the beauty and vibrancy of our downtown business area, and because of Winchester's diverse and growing community. As an active volunteer, I have significant knowledge of our local town government and community, making me particularly effective at understanding the issues. I have extensive experience in public outreach and collaboration to develop reasonable and fiscally sound solutions. I look forward to working with the other Board of Health members to promote wellness for a healthy community, raise awareness of mental health needs, alcohol and opioid abuse, and prioritize social and emotional health. I will work to keep up-to-date vaccination rates high, since this is critical to keep our masks optional policy. And I'll support environmental initiatives on heat, radon, and tick and mosquito-borne diseases. I ask for your vote for the Board of Health, and thank you.
Thank you. Lauren. Please unmute yourself.
Good evening. Thank you to the League of Women Voters and to you, the listening public, for this opportunity to tell you a little bit about myself and ask for your vote to the Winchester Board of Health. I've been a Winchester resident for over 27 years. I'm a business owner and a funeral director with my husband, Joe. We've owned Costello Funeral Home for over 20 years, and the business has been in town since 1961. I'm a mother to 2 adult children, Joseph Jr., age 22, Emily, age 20. I'm an active volunteer in town, a member of many clubs and organizations, including a board member. I've been a member of town meeting for the last 17 years and have been a part of some very difficult budget and project decisions. I'm a member of the League of Women Voters for the last 15 years, member of the board of the Winchester Chamber of Commerce, a member of the ANCA Society and the Winton Club, 2 women's service organizations that exclusively support Winchester residents and Winchester Hospital, and I was a member of the Massachusetts Funeral Directors Association Board of Directors. So clearly, I'm engaged and invested and a collaborative worker. I'm a good listener and a problem solver. I work with grieving families for a living. I'm experienced with local inspections, the Federal Trade Commission, OSHA, state and federal local regulations, and I'm familiar with the boards of health across the Commonwealth. Most importantly, I'm familiar with prioritizing.
Thank
The
you.
Winchester, oh, sorry.
I will now ask a series of questions that were prepared by the League of Women Voters of Winchester with extensive input from the public. The questioning will end at 8 p.m. to allow for closing statements, even if all questions are not asked. The order of the first question is Jen, Ruth, Lauren, Greg. What is the role of the Winchester Board of Health? Jen.
Sorry. Yes, the Winchester Board of Health is responsible for protecting the public health and the environmental health as well. The Massachusetts state statute sets out the responsibilities for local boards of health. We track and report disease and prevention information in collaboration with the Department of Public Health. We promote sanitary living conditions like in housing and restaurant and permitting. And as I mentioned, we protect the environment. I think the role for the Board of Health will be expanding, as we've seen with COVID-19 over the course of the past 2 years. The issues are going to become more complex, and we're going to need, I think, policy experience like my experience to be able to sort through some of these more complex issues, review new regulations and new guidance that will be coming out from the state and the federal level, and work together more across our town in different sectors to address some of these more complex issues that the Board of Health is going to be responsible for going forward.
Thank you. Ruth.
So good evening. The role of the Board of Health, as charged by the Winchester Town Charter, is to protect the environment and public health of Winchester. It's a broad charge with many individual tasks and responsibilities within it. The primary role is to establish local policies regarding all aspects of protecting the environment and health, such as mandates governing actions during health crises, such as our current one, emergency preparedness, mental health support for all age groups, and tobacco and alcohol use, and food safety. We have to oversee health violations and work with violators to ensure that they comply with them. The Board of Health works closely with the Health Department to impose fines for non-compliance with safety inspections or permit violations, and to ensure alignment with all state policies and regulations. It has to work closely with town staff, schools, boards, and committees, the Winchester Hospital, businesses, and the public, to listen to concerns and work together to find solutions, and to revisit those solutions when events change. An important part of the role of the Board of Health is to communicate regularly and effectively, and to do so with all sectors of the Winchester community, health, government, businesses, schools, and the public, to constantly improve messaging, education, and to continuously find ways to build a healthy community together. Thank you.
Thank you. Lauren.
Thank you. The bullet points on the Winchester Health Department website are prevent, prepare, and protect. And clearly a lot falls under those three concepts. With regard to prevention, enforcing and setting regulations and safety protocols, disease prevention, and vaccinations. Under prepare, emergency preparedness of our health and of the environment. Under protect, environmental protocols, public health, mental health, tobacco, and substance abuse. Now, clearly there's a lot that falls under this little umbrella, and our job as Board of Health members would be prioritizing and addressing fluid and changing needs of the community. Thank you.
Thank you. And Greg.
So I'll add to what my fellow candidates have said, that there are the sort of statutory roles of the Board of Health, but I think as public servants as an elected body, the most important thing for any board, particularly the Board of Health in these times to do, is to listen, learn, and collaborate with town meeting members, with other residents of town, with other boards within the town, to help understand what the pressing public health issues that are facing different constituents would be. And I think it's important to be stewards of public health for all of our residents and not just a select group of our residents. And that requires working in multidisciplinary fashions. These are the kind of things, working with schools, working with our restaurant owners, our business owners, working with people such as the Coalition for a Safer Community, which is run out of the health department, and really understanding the roles that can be played in terms of setting and enforcing public policy. And things may change. And so it's about understanding what current status of public health concerns are, being prepared for changes in public health emergencies. And I think although the pandemic is a big issue right now and will continue to be so for the next few months, it's also trying to understand what other public health and environmental concerns are being raised in our community.
Thank you. The next question, the order is going to be Ruth, Lauren, Greg, Jen. Is there any single issue that motivates you to run for Board of Health? If yes, what is it and why? If no, what do you think is the most important issue facing the Board of Health today? Ruth.
Thank you. Yes, the single most important reason that I am running for the Board of Health is that I'm passionate about the actual topic. I've been a long-standing, I have a long-standing interest in public health, but also in this particular time of COVID and in this particular time in our town, I'm passionate about ensuring that Board of Health decisions are data and fact-driven. I bring a strong science lens to my position on COVID and on the environment and all of my positions. So I'm sorry, let's see, it was okay. And I apologize. My position on COVID regarding data-based decision-making is that we certainly need to pay attention to all of the metrics. And there have been times when I have disagreed with the decisions that the Board of Health has made in the past. And there are times when I have certainly agreed with them, and I will be bringing that weighing of data to each decision that I'll be making, whether it's COVID, environmental, or other issues. Thank you so much.
Thank you. Lauren.
Thank you. I think, of course, the single most important issue facing us is the mask mandate. Even though the metrics and the COVID dashboard say that it's time to lift it, we're still working for the school committee to lift it in the schools and make sure that our kids are taken care of. And that, of course, lends itself to mental health. We're facing a national crisis. Depression, isolation, and suicidal ideation in little kids, in our teens, even in our elderly, need more attention. At Worcester Polytechnic Institute this year, there's already been 6 suicides in the last several months. Poor little children aren't allowed to go into school and hug their teachers. Our schools need more social workers to identify and articulate and have intervention for this purpose. I'd like to delve a little bit more deeper into the mental health crisis that is facing our community and the greater world. Thank you very much.
Thank you. Greg.
So this is my first time ever running for public office, although I've held various leadership positions in the hospitals where I worked and have been involved in lots of policy-making decisions when it comes to clinical care quality improvement and other areas of healthcare delivery. Obviously, during the pandemic, I spent lots of time working with families, patients, and parents, counseling them through the fears and the challenges they had about sending their kids to school, about their own health of their friends, families, and relatives, about what they couldn't do, about the access and availability to vaccines when they became available. And all of these conversations really led me to then think about how could I then give back to people other than my patients and my coworkers, but think about how I could help advise and work with people within my own community. And what motivated me to run really was this desire to really help the broader community understand from a scientific, from a medical, from a healthcare delivery perspective, the challenges that we face as a town, as a Commonwealth, in the current era of the pandemic. But more importantly, I got disheartened by seeing some of the discussions of the Board of Health in the late fall and in December when the mask mandate was rescinded. And it was rescinded at a time in which there was a surge of the new variant, and none of us could have expected that. And that made me realize that I wanted to make sure that there were data-driven, scientifically minded, and healthcare appropriate folks on the Board of Health to help guide the town and the health department. Thank you.
Thank you. Jen, and if everybody else will please mute their microphones.
Yes, I too, like Greg, I've been working on my professional career, also related in public health and health policy. I have 3 young children and spent a lot of time managing my family. And I too wanted to really give back to my community. It's not easy when you're busy, but we're rooted in the community. We're bringing up our families here. We're running businesses here. And so it's really our own residents who have relevant experience who will be determining the future of Winchester. In terms of a specific issue, I am very concerned about mental health and how it's been exacerbated by the pandemic. I think we need to develop a long-term plan and robust infrastructure for addressing mental health in Winchester. A recent survey by the Massachusetts Department of Public Health found that during the pandemic, in Winchester specifically, 21% of adults reported more than 15 days over a 30-day period of poor mental health. I would like to retain my seat on the Board of Health. I want to work with the residents, the leaders in our town, and the Winchester Coalition for a Safer Community, who's already been working on all of these issues, to find out what they need, where there's gaps, and how we can really shed light on promoting access to care for mental health, awareness about the issues, supporting the infrastructure, and addressing stigma in mental health.
Thank you. The next question, the order is Lauren, Greg, Jen, and Ruth. How will you approach competing budget priorities? What issue should be addressed first because it offers a high value for comparatively low expense? And conversely, what program or expense might you cut or eliminate? Lauren.
Can you repeat that for me? I can't hear you.
I didn't follow my own advice and unmute.
Oh, thank you.
Okay. How will you approach competing budget priorities? What issue should be addressed first because it offers a high value for comparatively low expense? And conversely, what program or expense might you cut or eliminate?
That's a tough one. In terms of competing budget priorities, I would say I would defer to the health director, of course, because she has, complete overseeing of what is happening in the Board of Health. I would say that I would spend more budget on the Coalition for a Safer Community because you get more bang for your buck with that. There's a lot of volunteer workers, there's a lot of collaboration with the school committees and different programs that don't cost too much. Conversely, what I would think would be, I would eliminate for the competing budget would be, and I hate to say this, but something within the environment, some of the environmental programs that we feel that we can get grants for, that we might be able to eliminate if we don't.
Thank you. Greg.
In healthcare and in public health, resources are always finite. And I think discussions always have to be made around what the appropriate resources need to be leveraged in what frame and in what time. I think right now it is clear that the COVID mitigation strategies need a continued budget for some level, and I think that includes the maintenance of testing availability as well as vaccine clinics moving forward. I know that we've talked a little bit about the rescission of the mask mandates, and I think I too agree that at the current state, mask mandates are right to be removed from a public health perspective. But I think we need to remain vigilant about whether we might need to reinstitute them based on the changing trends in the pandemic. I think it's very important to realize that pandemic mitigation strategies are really, and I think the best analogy I've seen, sort of like a layer of Swiss cheese. No single mitigation strategy is perfect. Every single one has holes in it. And so removing one layer of the Swiss cheese doesn't mean you remove all the layers of the Swiss cheese and declare that a pandemic is over. And we can't just say, well, we've lifted the mask mandate. We don't want to do anything further as a town to mitigate against COVID for the future. And I think that means investing in working with the school department around filtration in the classrooms, making sure that vaccine clinics are providing up-to-date vaccinations, and making sure that all residents have access to treatment, testing, and vaccination moving forward, while we keep our eye on the data.
Thank you. Jen.
Part of my campaign platform, as I've experienced over the past couple of months of being on the Board of Health, is to really use evidence to determine the priorities that our Board of Health will work on. Winchester Hospital conducts community health needs assessments, which take into account the health priorities that Winchester residents actually report are important to them. They consider all factors, environmental health, access to care, socioeconomic factors, lifestyle behaviors. These assessments are extensive, they're evidence-based, and they really provide actual input from the community about what the health concerns are. So if we're trying to prioritize, and we have limited budgets, as my colleagues here have said, I would definitely use these assessments to determine where we should be looking. In terms of, I agree with Lauren that kind of low-hanging fruit is probably investing more in the Coalition for Safer Community, as they are a key kind of collaborative organization in the organization that helps to distribute information and gets information back from the community. I think investing money in resources in the coalition would be a great idea. I don't think I'm prepared to talk about what programs I would eliminate. I know that there's opportunities for grants to cover all public health programming. So I'd say instead of eliminating, I would focus on trying to get grants to continue support.
Thank you. Ruth.
Thank you. And those are three good answers. It's going to be hard to expand on other than just ditto a lot of those. So I will highlight, yes, of course, in the current crisis, we do need to continue funding everything regarding COVID, from continuing with our testing to, when appropriate, bringing out and promoting vaccinations for our 6-month-old to 5-year-olds. And continuing to stay vigilant with all aspects of the pandemic. I too have strongly supported lifting the mask mandate at this time. And that is partly in recognition, not just of the declining numbers, but of the needs for balancing those medical pieces against the social and emotional and learning pieces of our children and of the mental health needs of all ages. So, with that in mind, I would like to hang on to and expand whatever we can for mental health services. Health departments across the state of Massachusetts have been underfunded for years and have been calling for more funding. The pandemic has just simply revealed a lot of those shortcomings. So, we need to appeal for more funding overall. Regarding what I would cut, I would not cut environmental things, but I will point out that regarding climate pieces, I've been part of applying for over $350,000 in grants, and we have landed over $250,000. And regarding fiscal responsibility, the climate action plan that I have been very instrumental in bringing to the town was recently cited by Moody's as a key piece of maintaining our AAA bond rating for the town of Winchester. So
Thank
one
you.
can be fiscally sound and deal with the environment. Thank you.
Thank you. The order of the next question is Greg, Jen, Ruth, and Lauren. How would you work with the school department on impacts of the pandemic and on the social and emotional health of students? Greg.
Thank you for that question. And as a pediatrician and as a parent of 2 children, this is obviously a question that I've thought a lot about and an area that I think I have a lot of experience and expertise in terms of working with parents, schools, teachers, and school administrators. In fact, I've been advising my child's school currently throughout the pandemic about their own pandemic policies. I think the first thing is that it's important to be flexible. It's important to listen. It's important to understand the needs of an individual school or school department and understand where their constraints are. It's not just about masks or no masks. I think that it becomes a lightning rod issue. It becomes an issue that a lot of people talk about because it's a visible representation that something is different in our society. And there was a need for universal masking, and there was a need for remote learning. There was a need for hybrid learning when the initial sets of cases came out now over 2 years ago. But now it's about thinking about how can a school system work to maintain keeping kids in school, fostering their social emotional learning, and addressing their challenges that they face. Masking is not the only reason we have a mental health crisis among our youth. This has predated the pandemic, but it's been sort of fed in through high-risk behaviors such as vaping or the opioid epidemic or bullying or social media. All of these things have now been exacerbated by the pandemic, and we need to work together with the school department to develop programs, educate people. The Coalition for a Safe Community has been doing this already, and I'm sure that there's a lot more things that we could continue talking about because this is such an important issue for our town.
Thank you. Jen.
You know, the one gap that I've seen since I've been on the Board of Health is really the lack of collaboration across the different town boards. So first of all, I would encourage and try to work more jointly with our school committee, with our select board, so that we can, where there's areas of overlap, like children's mental health in schools and emotional and social learning, that we're actually having opportunities to work together, not just when there's a hot button issue or not when someone wants to call another board member because they're upset about something, but that we plan ahead and proactively to have a couple joint meetings a year, for example, to work on issues where we overlap. Specifically, there was a youth risk behavior survey that Winchester Public Schools presented this year that showed that 11% of Winchester high schoolers reported suicidal ideation. It was presented at a recent Board of Health meeting, and I asked the administration, how do the schools use this information to address the issues? Are they able to integrate content as needed into new curriculum? The answer, which was I needed to be reminded of, was that, well, if you want to add something new, something else has to be taken out. So again, to me, it comes down to evidence to be used to actually determine and discuss priorities. How will we work together as the Board of Health and the school committee to prioritize mental health for our students and children? We can say we want to do things, but if we don't work together, we won't achieve our goals.
Thank you. Ruth.
Thank you. It's hard going later after all of these good comments, but yes, I'm a 15-year veteran, public school teacher. So this too is an issue very near and dear to my heart. And I would stress to the Board of Health, listening to our schools, to our school committee, to our students and parents. I've actually personally been in the schools a number of times in my role in the climate team here in town. I've spoken to over half a dozen science classes in the middle and high school in the after-school environmental club environmental club. I would support increased communication, certainly, and I'm good at doing that, going out and soliciting the folks who would be involved in these collaborations. I have actually spoken before the school committee on 2 occasions. And we do need to just open up communications. I'll leave it at that. Thank you very much.
Thank you. And Lauren?
Thank you. I think we can improve this in 3 ways: communication, collaboration, and preparedness. By communication, simply with the Board of Health updating our website, make more information available, a quicker rollout so that that information is quickly available and user-friendly. Collaboration, clearly collaborate with other organizations, departments, and especially the teachers. And lastly, preparedness. And this is my big thing. When the pandemic hit and my daughter was in college and she came home for spring break, and then she didn't go on spring break, and then she never went back to school, and then she had to Zoom school her first year in college and was very upset. And my comments to her were, why don't we watch what the teachers do? Why don't we watch and see if your teachers are prepared? Just log on and do what they need you to do. And having said that, our Zoom schooling, if it's ineffective, it affects our children. It affects their learning, it affects their anxiety, and it affects their mental health. So I think we definitely need to work collaboratively with the teachers, with the schools, and with the school committee to make sure that we have a method of preparedness should this ever happen again. Thank you.
Thank you. The next question in the order is Jen, Ruth, Lauren, Greg. The question is, how would you approach mental health and substance abuse problems impacting the community at large? Jen. And if everyone else will please mute.
So as I've discussed, I think we've all spoken a bit about the Coalition for Safer Community. I have already been in the trenches on this, as has our Board of Health over the past, decades. So we have a strong foundation there, and I would collaborate with them. I would listen to better understand what gaps and opportunities exist. Again, as we've discussed previously, it doesn't just impact people at home. It impacts families in school. It impacts our seniors. And so I think more investments need to be made to really increase awareness, to address the stigmas. Stigmas prevent people from talking about their health. It prevents people from seeking treatment. And we need to realize and figure out what additional resources are needed to create that infrastructure, and to keep the collaboration across the town boards to promote those so that we can really work together, as mental health and substance abuse really span all areas of life. I think if we are able to talk about the mental health, then the substance abuse will follow, because mental health issues can lead to substance abuse. So if you're able to talk about it in the beginning, we might actually be able to prevent some of the substance abuse that we see downstream.
Thank you. Ruth.
Thank you. Without any question, mental health and substance abuse are top of the list for what we need to be dealing with on the Board of Health. I was one of the participants in the recent Winchester Hospital Community Health Listening Session. That was in February 2022, and they conducted a community health needs assessment. What came out of that assessment, along with the youth risk behavior survey in our schools, which was done in August 2021, but is an ongoing every other year survey, is absolutely mental health, suicide, ideation, substance abuse, including opioid abuse, and smoking issues, are all top of the list for what we need to be dealing with. Bullying, equity concerns, access to sufficient mental health providers is a really big piece of what we need to be paying attention to. Obviously, we have a wonderful local community college, a hospital, I meant to say, and the health department has close contacts and with the hospital. The Coalition for a Safer Community is a very big resource for us here in Winchester. And my time's out. So I'll leave it there. Thank you.
Thank you. Lauren.
Thank you. Clearly, we are all revisiting the Coalition for a Safer Community over and over again in our discussions this evening. And of course, knowledge is power. Whether it's substance abuse, right now, I think there is an eating disorder presentation going on right now, sponsored by the Coalition for a Safer Community. There are many educational and programs available and also intervention, but we need to take a stronger role in that. The Coalition for a Safer Community is a small part of what the Board of Health is, what the Department of Health offers. So clearly, we need to try to get more resources and more budgeting to make that a larger piece of the puzzle so that we can help our children. We keep going back and we keep revisiting the same issues, mental health and substance abuse. Let's get on it. Where there is a will, where there is a way. We care so much about our children and our teens, and we also have adult problems that we need to address. So we need to work for the bigger picture and work interdepartmentally. We need to work with the first responders, we need to work with the schools, and the Board of Health should develop a larger plan. Thank you.
Thank you. And Greg.
Let's be real for a second. Mental health is a giant problem in our society. It's a giant problem in our healthcare system. And there's no way that a single Board of Health or a single group of 3 people is going to be able to solve this. But I think we need to chip away at what we can. And I think one way to chip away at what we can is to really think about the tone that we have as a citizenry in our community. You know, there's been a lot of divisiveness in the community because of the pandemic, because of different policies within the schools. Children see that, teenagers see that, they feel that. They feel that their parents are concerned, that their family members are bickering at each other because they're stuck at home and not able to do what they want to do. And I think we need to come together as a community and recognize that we need to be kind to each other, empathetic to each other's issues and challenges, and work together and not feel like we're tearing each other apart over issues that we sometimes can agree on. And I think that's an important thing for all elected officials in the town. You know, in the terms of the Board of Health, yes, there are programs that exist and we absolutely should resource them, and we absolutely need to educate youth and young adults about the dangers of vaping, the dangers of substance use, and think about how to create community referral resources for mental health. But that costs money. Not all health insurances accept all that, but we need to really think about what tone we set. It's about stigma. Someone said that already. Reducing the stigma of mental health, being willing to talk, being kind, and being empathic with each other, I think is the first way we need to move as a community.
Thank you. For the next question, the order is Ruth, Lauren, Greg, and Jen. The question is, what are some effects of climate change on public health, and how can we mitigate them in Winchester? And would everyone please mute their microphone except Ruth? Ruth.
Thank you. Thank you so much. Yes, climate change is an enormous impact on our public health. And as many of you know, I led a fantastically talented group of 26 people here in town over the course of 14 months. And collaboratively, we did write the Climate Action Plan for Winchester. That is now the guiding document for climate work in Winchester. The main impacts you'll find outlined within there for climate change on public health have to do with the high heat days that we will be experiencing and already have, the impacts of growing numbers of ticks and mosquitoes, and to some extent, even in Winchester, rats. And those populations are growing because of the change in our warmer winters and warmer summers. And they're moving up the East Coast in larger numbers. The populations are growing. The third big area of health impacts on climate change have to do with extreme storms, extreme cold, wind, flooding issues that then result in a variety of building problems, molds and such. What we can do about it, we have a plan. It's a blueprint. We just have to follow the steps to do that. And there are a number of things that I have been working with already here in town, especially regarding heat, working with the rec department and our town manager to see what we can do to reopen splash parks and build new ones, have a variety of other safe outdoor recreational pieces. Thank you.
Thank you. And Lauren.
Thank you. And I'm going to backpedal a little bit and the last question when you asked, where would I eliminate some of the funding? And I said, with the environment. Clearly, that is important. Luckily, we can work closely with the sustainability director and clearly with the Climate Action Plan Committee to develop solutions, which they have already done most of that, and to explore even further, green initiatives and solutions that we can implement in the town. I think right now, the most important thing that we need to pay attention to are, the tick, mosquito, and the rodent-borne diseases and control them. We have a pretty good flood mitigation plan in place. We're putting culverts underneath, widening the rivers, things like that are very, very important. One thing that definitely needs to be addressed are the algae blooms in the ponds and the lakes that are taking over. And I know locally, some of the residents are very concerned. They would like to swim in Beauregard Beach, and that just doesn't happen. So we really have to develop a plan in place to take care of our residents and to take care of our nature. Thank you.
Thank you. Greg.
One of the best things, I think, as Lauren just mentioned, about being in Winchester is the access to nature and the access to environmental areas, for our residents and for our families. And I think that's really important to think about how protecting those areas and improving those areas would allow for better health. And as a pediatrician, as a pulmonologist, I'm well aware of environmental impacts on health. There's no question that pollution and environmental exposure lead to upticks in asthma and allergic diseases. There's no question that climate change leads to changes in tick-borne illnesses and other types of illnesses. And floodwaters can lead to different kind of bacteria that populate environments and cause disease. And so absolutely we need to work together with the town, with the Conservation Commission and other members in town to think through, where can environmental impacts on health be mitigated and how it can be done appropriately when it comes to planning new developments, when it comes to working through infrastructure and construction. And I think, again, it comes down to communication and education. It comes down to thinking about where are there areas where health is impacted, and what can we as a town do versus what we need to rely on the state or other kind of federal resources.
Thank you. Jen, and everyone else, please mute your microphones. Thank you.
Yes, and everyone gave great answers, and I'm happy to see that Winchester is taking environmental issues to the next level. As Ruth mentioned, with the 2020 Climate Action Plan, the change in the climate is having impacts on extreme heat, intense storms. We talked about flooding a bit, and the warmer weather is impacting pests like ticks and mosquitoes and rats. And I think goals such as in the Climate Action Plan, like reducing carbon emissions by 80% by 2050 in Winchester, which is one of the main goals, is a really great goal for the community to focus on. I see climate and the environment as part of the town's larger strategic plan, and it's one of the many priorities that Winchester needs to consider. I would point out that the Winchester Climate Plan has 69 initiatives. It is very thorough, and I'm glad that my opponent has been laser focused on this issue. It also includes a robust communications plan, but all of this will require substantial investments by the town, and time and resources to complete. So I would like to see the Climate Action Advisory Committee work with not just the Select Board, who they've been working with, but also the Town Board of Health, as it falls under our purview, to figure out how best to prioritize these issues. As we know, resources are limited, and there's other issues like mental health that we've all discussed that are going to need to be a priority. Thank you.
Thank you.
Is there a rebuttal which is allowed?
Yes, you would like to rebut?
I would just like to note that a large number of the most important health aspects of the Climate Action Plan are not actually big ticket financial issues. The most important things that we'll be directing the Board of Health toward, we've already actually started, and brought forward, for example, a heat statement a year ago that was developed with the health director, with our fire chief, and was unanimously endorsed by our select board. That follows with a page and a half of recommendations. The majority of those are educational, public relations kinds of things, raising
Thank you.
awareness. Thank you.
Thank you.
Yeah.
Would anyone else like to rebut? Everyone's on mute.
Yes, thank you. And that's great to hear. I do think it's important to note that the report has pointed out that 76% of carbon emissions in Winchester come from individuals. So I think it's really important, as we're culling through those 69 initiatives, to really try to focus on the initiatives that will have the biggest impact, and where residents can be incentivized to make personal changes to how they live, because that won't be easy. But I do think it's really important, and I applaud my opponent and all the different subcommittees that are working on this issue.
Thank you. We'll now move on to the next question, and the order will be Lauren, Greg, Jen, Ruth. The question is, do you see any role for the Board of Health to develop policies to improve the safety of girls and women in homes and public areas in our community? Lauren. Please unmute your microphone. There you go.
Thank you. I think that's a pretty broad brush to stroke, stroke to brush. When thinking about, of course, what goes on in people's homes, clearly we would have to work collaboratively with the first responders, who are generally first on the scene when something happens in somebody's home, with the teachers and the social workers. I think it is imperative that we do pay attention to that, and that we do, institute a program in place, a place where people feel safe reporting things that happen in their homes. And because it's more rampant than we know, it's part of a larger picture. And we keep going back to the Coalition for a Safer Community. And the key word is safe. Where do women and girls feel safe reporting these kinds of things? Where do they go for help? Where do they go for intervention? I would like to be a part of that. I would like to see that happen. And I would like to work collaboratively, again, with the social workers in the schools, with the teachers in the schools, with the first responders and the nursing personnel at the hospitals. Thank you.
Thank you. Greg.
Intimate partner violence is a huge challenge for all communities, and no different even in well-off communities as well. And I think the first step is really, again, thinking about resources, thinking about which areas of the town can help, and where these kinds of issues can be reported. I think it's clear that the police department would be a place that would be a natural group to work with to ensure that programs are in place for people to feel safe reporting, feeling victimized, feeling bullied, having crimes committed against them in the home that may not be visible otherwise. And this is obviously a longstanding challenge. And I think the Board of Health does have a role in terms of this being a public health issue and a mental health issue that may have been exacerbated over the last 2 years, to ensure that there are safe spaces in the schools, in the police department, using other community resources to help and allow for women, girls, and quite frankly, anybody who's feeling victimized or bullied or feeling like they are out of place in the community because of divisiveness, because of anger, because of, whether it be physical or emotional harm. It's important for there to be safe spaces, and that there are multiple places that we, I think, could work as a community to develop those safe spaces.
Thank you. Jen, and if everybody else would mute, please.
Yes, I agree with both Lauren and Greg. I think there is a role for the Board of Health in helping to create safe spaces for women and girls in domestic violence. I think this is an issue that is not like other issues where people aren't talking about what's really going on in their homes, or what's going on in their private relationships. The Youth Risk Behavior Survey showed a high incidence of sexual assault in high schools. And I've been thinking a lot about how That's just one example, but how can we get families and residents openly talking about issues that are really at the core of our values, and really go against what type of community Winchester wants to be. We do have a social worker resource that works in our police department that is available, and that's an example of how can we get the information out there to the community that there is a person that works at the police department that is an available resource for all sorts of mental health issues or other issues that community residents might need to learn more about. I think we need to work on communication, again, to address the stigmas and to have people feel more comfortable going to people that they trust. And finally, I would say that we need to just collaborate and listen and work together to really figure out, look at other towns and look at other communities, and see what they're doing.
Thank you.
I think you called on me, but you were muted.
Ruth, yes.
Thank you. And yes, in addition to looking for safe spaces in homes and in public spaces, I would just note that a piece of that certainly has to be online safety for many of our residents and especially young girls in terms of online bullying. Yes, domestic abuse happens here in Winchester, and it is an issue that I've spoken with our health director about. And I will note that while many here were focusing on the domestic abuse and issues that can happen within the home, we've had multiple recent horrible attacks in the Fells, and it is not entirely a safe community outdoors as well, and we need to be very aware of that. I have personal friends who've had their homes broken into, and it's women who are attacked. I'd like to point out that another huge resource we have here in town is the Network for Social Justice. That is a wonderful piece that we can work with. I have actually worked with the Network for Social Justice in bringing forward an important piece some years ago, which was when I led a team of 30 people to change the name of the Board of Selectmen to the Select Board. It opened up a year of conversation around issues about women, and it allowed us to look a little more deeply within ourselves as a community. There's a lot more I'd like to say about that question, but thank you very much.
Thank you.
Can I say a rebuttal?
No, I'm not going to, because we are going to our final question, and
Okay.
we have basically 4 minutes for it.
Okay.
Okay. So the next question, the order is Greg, Jen, Ruth, and Lauren. How do racism and other forms of inequity impact public health in Winchester? Can you speak to the role the Board of Health can play in promoting equity? Greg.
Thank you for that very important question. I think that when we think about inequity in health, this has been exacerbated by the pandemic, but it certainly predates the pandemic. There's inequity based on race, ethnicity. There's inequity due to structural racism in our society, homophobia in our society, transphobia in our society, as we're seeing in the news more recently. This all resonates and leads to, I think, demagoguery, and it leads to people getting upset over issues that have really nothing to do with health, but making people feel like they're ostracized and different. And that's no different in this town as it is in anywhere else in this country. And that can impact mental health. We've talked a lot about mental health, and racism absolutely affects mental health. So does homophobia, so does transphobia, so do all of these inequities. But it also affects access to care, access to vaccination is one thing that we've seen even locally about how people feel. And I think we really do have a place, again, to say, not just to say that racism, structural racism, all of these other inequities are a problem, but we have to first say as a community that they exist. Whitewashing them here in our community is a problem. There are people in our community that probably would not want to think that such things exist in terms of schools, in terms of education, in terms of our businesses, but it does exist. We have to name it. We have to recognize that it impacts the health of our citizenry. And I look forward to working with our town boards to make this a problem that is reaching better solutions.
Thank you. Jen.
Yes, health equity and other social determinants of health and racism definitely have an impact on people's health and their mental health and their confidence as people. Winchester as a community has been working hard on this issue. They've been talking about it more and starting with children in school and making sure that people feel comfortable talking about themselves and who they are. And that is really important. It's really important to start those conversations with our youngest learners and our youngest children. It's really important to have those conversations too as families. Children listen to what their parents say and how they address each other and how they make comments. And so it's really the role models that we can all be to help work on these issues. In terms of the Board of Health, again, the local community health needs assessments have identified equity and health disparities as a big issue for people in our community and surrounding communities. So that's definitely an issue that I would continue to have our town and our Board of Health prioritize going forward.
Thank you. Ruth.
Yes, a very important issue in our town. And it was not even a year ago that we saw a number of very pointed anti-racist, anti-Asian incidents in our town here. And we had a very large rally on the Common to address that. I have had a longstanding interest in this issue. I will note that almost 20% of Winchester is now of Asian descent. That's quite a lot of change in a short period of time. We do have significant other populations within our town, Hispanics and Russians and many others. We're a very diverse community, and we are finding our way with becoming a welcoming community. We still do not have as much representation, for instance, in our local town government as representative of the numbers of folks of different ethnicities in the town. So we need to do a better job of that. Some of us have gone out actively recruiting folks to become town meeting members, to run for various boards, and to try to become a more welcoming community for everyone. I myself have gone into the Winchester School of Chinese Culture and spoken. It was actually to children, and it was a climate piece, but to maintain that communication. We need to listen to our community, not decide what we need to be doing on their behalf. But I would strongly focus on open communications and making a more welcoming community. Thank you.
Thank you. And Lauren.
Thank you. This really actually ties into the rebuttal that I wanted to give on the last question. And it is about promoting equity and health and social equity. When we ask about, violence against women and girls, it's also violence against the LGBTQ, the transgenders, also violence against boys in the home and in public. Now, we live in a very diverse community, but we also live in a very educated community. Knowledge is power, and education is key. And we have the resources to make sure that these problems don't happen in our community with zero tolerance and shouldn't and wouldn't happen. So I think, once again, let's go back to addressing with the Coalition for a Safer Community all the things that we can do for each other and support each other. When we hold ourselves out as being a proud and diverse community, we need to stand behind that, and we need to stand behind our people. It takes a village. Thank you.
Thank you. That ends the question portion. The candidates may now make closing statements up to 60 seconds each. We will start with Lauren, then Ruth, then Jen, and Greg. Lauren.
Thank you. Thank you to the League of Women Voters, to the other candidates, and to the viewers. I especially want to thank the other candidates. You really have put out your best tonight. Some of us have to lose, and I'm sorry about that. I hope it's not me. I'd love to have coffee with you and discuss everything because I think we all bring something very, very special to the table. But to the public, you can see who I am by listening to me. I am experienced, invested, engaged, and a team player. I have a proven record of success. I ask for your vote on Saturday, March 19th at Winchester Hospital. At Winchester High School. Thank you very much.
Thank you very much. Ruth, and everybody else on.
Thank you to the League of Women Voters. I thank Jennifer, Greg, and Lauren for a great conversation. And I thank you to all who are listening in. Winchester voters have a choice to make in electing a trusted, experienced community member to protect our public health, and one who will competently and steadily lead our town toward a healthier future for all. I stand for science, wellness, collaboration, and open communication. I have a vision with long-term goals, and I hold the best interests of the Winchester community as I seek this local government seat. When elected, I will faithfully execute the board's sworn duty, which is to protect the environment and public health. To meet this broad responsibility, we must restore the public and public health by actively listening to our community. I will continue my dedication, commitment, and trusted record of local civic participation and open communications. I ask you to join me in building a healthier future for Winchester. Please vote for Ruth Trimarchi. Thank you.
And Jen.
Thank you to the League of Women Voters for having us here tonight. It has truly been a pleasure. I have been serving on the Board of Health for the past 2 months, and I have learned a lot. I've learned that there's still much to learn, but I've also learned that there's a lot that we can do. And I have met so many people, new people in town, even through the campaigning process and through my role on the board over the past couple months. I promise to work on behalf of residents and support your views and support the priorities that are important to you. I will use evidence to determine these priorities. I will collaborate with other boards and town meeting members to support policies that promote the best health options for our community. And I promise to work on mental health. I will develop a long-term plan for addressing mental health in Winchester with input from everybody. So I just thank you for your consideration, and please vote for me on March 19th. Thank you so much.
Thank you. And Greg.
And I'll echo the thanks again to the League of Women Voters for sponsoring tonight's debate. And also thank you to all my fellow candidates for such an engaging and thoughtful discussion. Winchester is filled with residents who have stepped up to face the challenges of these past 2 years in our professional and our personal lives. And I am proud to be raising my children in this town and excited to bring my professional experience to serve my family's community as a member of the Board of Health. However, I'm also concerned by the rising tide of anger and division that has emerged in town discourse, and hope that we truly can move beyond this and restore kindness and empathy to all of our decision-making and policy-making in town government. There's been way too much vitriol thrown out during the pandemic over policies, and this really needs to stop. My goals are to promote rational, science-based policies, to advocate for the health and well-being for all, and to find a role for government to help protect the most vulnerable. Relationship building and collaboration, trust and compassion. That's what a vote for me on Saturday, March 19th will bring to the Town Board of Health. Thank you.
Thank you. And thank you for participating in this debate. Please remember when you go to vote that Lauren Costello and Gregory Sawicki are competing for the 1-year seat, while Jen Inferna and Ruth Trimarchi are competing for the 3-year seat. Thank you again, and the candidates may leave the building.
Well, thank you, candidates.
Thank you. That was great.
Thank you, candidates, for showing commitment to our community by running for public office and for participating in our debate. This debate can be viewed at WinCam On Demand. Thank you, members of the public who rose to the occasion and sent us a lot of suggestions for debate questions. We thank WinCam for producing this event, the town clerk's office, and the election workers for organizing a safe, orderly, and inclusive election. We here on screen acknowledge contributions by a number of league volunteers who helped publicize, plan, and carry out this series of debates and related online information. And mostly we thank the voters for exercising your right to vote and have your voice heard. And as has been stated, voting will be at Winchester High School from 7 a.m. to 8 p.m. on Saturday, March 19th. Please stay tuned for the school committee debate, which we will begin after a short break of about 10 minutes. Thank you. Welcome to a debate for the Town of Winchester School Committee, sponsored by the League of Women Voters of Winchester. My name is Lynn Brodsky. It is my pleasure to represent the League of Women Voters of Winchester as we bring you this evening's event. Thank you to WinCam for hosting the Zoom format of this event and for broadcasting and streaming it to the public over local cable TV channels and the WinCam website, respectively. The League of Women Voters is a nonpartisan organization with a mission to promote informed participation by all eligible voters and public understanding of major policy issues. We do not support or oppose any candidate or political parties. We do study and take positions about major policy issues. We are organized at the national, state, and local levels. Our policy positions and activities can be reviewed on the respective websites. If this forum and our mission meet your needs or even inspire you, we encourage you to donate or become a member. All people may join. Student membership is free. This year, there are contested seats on 4 townwide boards, and these are the subject of 2 debates this evening and 2 debates the evening of Thursday, March 10th. All candidates who are debating this week, the candidates who are running unopposed, and many of the candidates for town meeting have generously provided the League with information about themselves and about their candidacies. You may find these candidate profiles on our website at lwvwinchester.org. Thank you, candidates, for submitting your profiles to the League. This evening's debate will be moderated by Mary O'Connor. Mary is a trained League moderator and a member of the League of Women Voters of the Cape Cod area.
Thank you, Lynn. Good evening. The candidates running for school committee are Karen Margarama Bolognese, Chris Nixon, and John Dobbins. The rules for the debate are as follows. Each candidate will have up to 90 seconds for an opening statement. The order of speaking was determined ahead of time by a random method. After opening statements, I will ask the candidates a series of prepared questions in rotating order. Each candidate will have up to 90 seconds for each answer. After each set of answers, the candidates or I may request a rebuttal. Should a candidate choose to rebut, the candidate will have up to 30 seconds to do so. I may on occasion allow a second round of rebuttals or ask a follow-up question, depending on how the discussion has gone. Personal references about other candidates are out of order. After our final question, each candidate will have up to 60 seconds for a closing statement. The closing statements will be given in reverse order from the opening statements. We will now start with opening statements of up to 90 seconds each. We begin with John, followed by Karen, and then Chris. John.
Good evening, Winchester voters. Thank you to League of Women Voters, and good evening to the other candidates, the incumbents. Look, just want to start out by saying I am personally a Winchester Public School graduate. My children are, 2 of them are Winchester Public School graduates, and we got one on the way. He was helping with some of the technical stuff earlier, so he should be finishing up here soon. And let me just introduce myself for people that don't know me. I've been a longtime coach, and I consider myself a mentor in the community. Well, I'll expound on some of these things a little bit later as we get through the night. I've also been active, my wife and I, and a lot of good, hardworking Winchester people in doing a local community charity, the Bridget Brigade. That charity helps out families that are struggling to take care of critically ill children. We help out financially, and we also help out with the hospitals, not just in Winchester, but in the greater community. And by the way, we're over 30 people or families who are helped so far. And I'll put a plug in it for now. It's been tough as the pandemic has been on all of us on doing fundraising for charities, and we have some applications in. So consider us, to the greater community when you're in the giving spirit. I've also been a 20-year naval officer. I consider myself a problem solver and a team player. I've worked as a
Thank
program
you.
manager at Hanscom. I have an MBA from Babson College. I'm a union member and American Airlines pilot. And
Thank
I'm
you,
running as a
John.
Fresh Eyes
Your
candidate.
time has expired.
All right, I'll have to get back to that.
Okay, we'll mute. Karen. Unmute your microphone, please, Karen, and start again.
That may help. So thank you very much, Mary and Lynn, and to the League of Women Voters, and good evening to everybody. My name is Cara Mariama Bolognese, and I am currently the chair of the school committee. I have been a member of the school committee. This is my third year. And prior to that, and on the school committee, I worked on various committees, subcommittees, such as the policy subcommittee and the curriculum subcommittee. I am also a parent, a mother of 3 children in the Winchester schools at the elementary, middle school, and high school level. And I've been very active in the Vincent Owen Elementary School, spearheading the international night there. From 2016 in its very first year. And then I was also coordinating the Science Park and the Butterfly Garden over there. And also serving on the school councils with both the middle school and Vincent Owen. Some of the items, some of my priorities are around fiscal responsibility and long-term planning. Also, I bring an MBA from the University of Michigan, and strategic business planning skill. I'm also interested in diversity and inclusion and mental health as we are emerging from the pandemic.
Thank you. And Chris.
Well, good evening, and thank you to the League and WinCam for arranging and broadcasting this evening's debate. Hi, John, it's nice to see you. Karen, it's nice to see you too, but I see you all the time. I'm pleased to introduce myself to those who don't know me. I'm a 23-year Winchester resident and a transplanted Texan who's fallen hard for New England. I'm a hockey dad of 2 girls and have an adult son, a second-class cadet at Massachusetts Maritime Academy. I'm in a medical marriage to an incredibly dedicated physician who was on the front lines of our COVID battle from day one and who has continued to provide great care to her patients and support her colleagues and her family in the face of our unpredictable pandemic. For my family and for our district, I could not be happier that we are now finally coming out of this. My experience as a parent of 3 kids who either grew up in the Winchester schools, including Lynch Preschool, or my youngest who's at McCall today, helps me understand our students pre-K through 12 growth through the pipeline. But it's my experience on the school committee and other key town boards or committees that affords me a unique appreciation for how Winchester both works and how Winchester doesn't. Beyond my role on the school committee since 2010, I'm a veteran member of town meeting, capital planning, the EFPBC, where we're making exciting progress towards the new Lynch Elementary School with a big submittal tomorrow to the MSBA. I have a hunger for achieving big goals as a district with a corresponding understanding for how to run the railroad. Understanding basic duties, decisions, and lanes of the school committee are an essential element of high-functioning government. A similar understanding of the workings of Winchester public body means a better chance at collaboration and coordination on major initiatives and change.
Thank you. We're now going to move on to the series of questions that were prepared by the League of Women Voters of Winchester with extensive input from the public. The questioning will end at 9:20 to allow for closing statements, even if all questions have not been asked. The order of the first question is Karen, Chris, John. Is there any single issue that motivates you to run for school committee? If yes, what is it and why? If no, what do you think is the most important issue facing the Winchester Public Schools today? Karen. You have to unmute, Karen. Good.
Thank you very much. Yes, so one of the issues that motivates me in particular for Winchester Public Schools right now is our children's mental health as they are emerging from the pandemic. I think that none of us could have envisioned over that 2 of the last 3 years would be spent in a pandemic, and that our students would need our support more than ever as they are emerging on the other side of the pandemic. So some of the initiatives that we've supported and that we continue to support are the Dean of Student Life, our nurses and guidance counselors, and programming so that we can continue to help our students. I would say that it is just important that we be able to provide these mental supports for our kids as we are going forward, and to emerge from the pandemic in a stronger position than before.
Thank you. Chris.
Well, thank you for the question. So I think of myself as a goal-oriented person. So when people use that word issues, my brain naturally goes towards goals. Those are tasks. And that's really not always the case. That may not be how the question was intended. So I'll try to answer it quickly from both frames. Speaking just from goals, there are many important goals that face the next school committee. We need to execute a long-term contract for a superintendent of schools. And then working in collaboration with the superintendent, we need to establish that strategic plan framework the committee began discussing in December. We're going to need to constructively negotiate a successor collective bargaining agreement with our teachers and support staff. We're members of the Winchester Education Association. And of course, in the fall, we need to rally around supporting the Lynch Project at fall town meeting, the project funding agreement, and a debt exclusion override in January. We need to secure funding for much needed work at the Lincoln School, the site work, and the McCall Middle School, and others. But if I think less about sort of goals and more broad issues, I think I'd like us to have a broader shared understanding of what we do, how we do it, and why. I'd like us to think about how we can gather information, how we communicate it to our parent community, help them understand what our leadership team does with that information. And I think we can do a better job as a school committee in being clear about that as well.
Thank you. And John.
Yeah, so just to finish my thoughts from the earlier, I'm running as the fresh eyes candidate and open ears, and I really truly just want to help and do my part to keep the excellence that we have in Winchester schools. And I do want to answer this question sometime tonight. It comes from my good friend, a McCall Middle Schooler, Bilal Paricha, who asks, what's in it for me? Bilal, I promise to answer that question tonight. Now on to the issue at hand. I put some things in the Daily Times, and then I shared on Facebook. And I do think that Karen was onto something there with the mental health. As part of my open ears, I'm new to the process. I've been talking to not only administrators, I've been talking to students, and then I would add that I'm not saying it was a surprise, but as I'm listening, teachers' mental health came up, not just once, not just twice, but more and more. And I've added it into my notes. I think it's something we have to address as a community, and it's an all hands on deck effort here. I'll have more to say about on that later, but I do think if I have to pick one issue, we're onto it. Mental health, it's the elephant in the room. There's a lot of tails to it. And then my ad is going to be that teachers' mental health and administrators, if that's the case, we definitely need to get the awareness up and then work on it together as a community. Thank you.
Thank you. The next question, the order is Chris, John, Karen. How will you approach competing budget priorities? What issues should be addressed first because it offers a high value for comparatively low expense? And conversely, what program or expense might you cut or eliminate? Chris.
Okay, that's a good question. I think the simplest and most important filter is what's in the best interest for student outcomes across the board. There's a lot of work that's done in the development of the budget. If I'm assuming we're talking about the operating budget, the superintendent brings forward a recommendation, but that doesn't come out of a black box. The superintendent and the leadership team work hard in the fall. They do reach out to the school committee, kind of share where their priorities are, what they're hearing. And we also welcome the opportunity for external inputs. So communication is always key in this. To the point of mental health, and I would sort of add to that, suggest self-esteem is certainly a part of that. We have from time to time acknowledged that a student with low self-esteem is not going to be a good learner. So I want all of our kids going into school each day to be excited to be there, excited to learn. That's what the physical spaces look like, but that's also the teachers and the resources that they have and the attitude that those teachers bring into the room. I think Mr. Dobbins makes an excellent point about being concerned about our teachers' mental health as well. And just on that last point, I did catch a clip of the earlier Board of Health debate to this issue of youth risk behavior survey and inputs that may not be included in the budget. We do have a Director of Health and Wellness, Jason Levine. He's a key part of the leadership team. He dives deep into this and is a key part in making recommendations to us. And we always take student mental health into account when we're making those difficult decisions. I appreciate the question.
Thank you. And Karen. You're up next, Karen.
Oh, I'm sorry. I thought it was Mr. Dobbins who was next. So thank you, yes, for the question. So I agree with Mr. Nixon that there are many high-value programs and our mental and many supports that we offer within school, and that we really have to understand our sources of revenue and issues and constraints of the budget. And I believe that our budget has to be a reflection of our community values, so that we have to support some necessary programs to remain a high-performing district. So some of these would include like our world language program, which we are seeking to continue this in high school for our middle schoolers who are continuing to study this, and also continuing to provide support around our Dean of Students, student life and programming, and our nurses and counselors. And I think with respect to programs that we would have that would be eliminated, then I think that's something that would have to be considered across the district with prioritization from our leaders from the Winchester Public Administration and staff.
Thank you. And you were correct. John, I'm sorry I skipped you. You get to sum this up.
Oh, that's okay. Okay, I was both good answers. If I could offer a different perspective, just as someone that hasn't been sort of inside on this, as wearing my program manager hat, I think every time we work with budgets, we have to work with the ground rules and assumptions that go into them, and those change. And then we have, at least in my area expertise, we build up requirements and then we prioritize them. And those can roll up into a larger strategy, which again, I think was mentioned earlier, if we communicate as leaders with the other committees, with the town especially, and really have transparency, that as things change, like for example, inflation right now, we're at 7%. So it isn't necessarily, I'm not prepared to say I want to cut this or cut that, but I do think we have to look at the balance, and that includes trade-offs. I mean, one thing, in my research and talking to people, I look at things like teachers' pay or our investment, per student, and those numbers, I'm not saying there's some room for improvement there. But again, if we have a larger strategy, we have requirements, prioritization, and then an open communication, transparent process, that's going to go a long way when we find out maybe we had a good year and maybe we can add some things back in because it's part of the long-term strategy, the road mapping, if you will. And if we have a year where things are going the wrong way, then maybe we have to push those priorities off. Thank you.
Thank you.
Mary, may I offer just a quick rebuttal?
Yes, you may.
Additional point. So that this question sort of speaks to working within a budget. To John's point about communication, I just want to underscore there have been times when the school committee and finance committee really hits it on the head. We've made investments We've raised money for big changes in the district when that was necessary. If not for that, we would not have all-day kindergarten, for which there was no budget, or specialized learning centers. If you build it, they will come. And that's really been helpful to our community.
Thank you. Would anyone else like to comment during the rebuttal? Okay, well, the next question, John, you get to go first this time, then Karen, then Chris. And the question is, how would you approach teaching about the history and impact of race and racism?
Okay, thank you for the question. This has come up a little bit in, I have a flyer I put together, and I have it on the wall here. I actually want to show people because my daughter, Maggie, is the one who did it. She's 21. She's a product of schools. I thought she did a really nice job. But boy, oh boy, is this raised some attention. So nice teeing up that and really, I think what if it comes to teaching race and racism, I'm looking, like I said, doing my research. I pull out the Town of Winchester Human Rights Statement, and I think that that's outstanding from 2020. I could read it to you right now if you want, but for anybody else that's not familiar with it, it's available on the town website, and that really hits home as far as what we're doing with the kids and making sure that if we're talking about politics in class, which I'm not sure if that's what you're talking about. I know I've got a lot of feedback on that. I just share this. My own son was coming back and talking about how the teachers were talking about their own politics in class, and I asked what were the courses, and he told me calculus and also physics, and this was during hybrid learning. So I tried to address that up the chain. I got nowhere with it. But if it comes to race and racism and how we teach it, I think the human rights statement right there, and certainly with zero tolerance for racism in our schools. Thank you.
Karen.
Thank you very much. So our teaching, our Winchester Public Schools teaching is embedded in the history and social science standards that are set by the state. And we want to, and we're required to teach to these standards. So our instruction has to be inclusive and critical and responsive to multiple perspectives. And when I look at the guiding principles as set by the state, it describes very succinctly that our students bring multiple diverse perspectives to the table or to the classroom each day. They're affected by race, ethnicity, culture, gender identity, disabilities, and just their own personal experience. So we need to create, or our teachers need to create a safe and respectful classroom culture so that our students can have these kinds of discussions. And students bring some big feelings to class. They want to talk about it, and I think our teachers are well prepared to be able to talk about these issues. I've participated in some professional development with the teachers on our Learning for Justice, and our teachers are having these conversations about how to have tough conversations in the classrooms and create that safe environment.
Thank you. And Chris.
Mary, I'm going to ask you, can you read the question back for me one more time?
Yes. How would you approach teaching about the history and impact of race and racism?
Thank you. So I have to say, I think my colleague Karen answered it very well, because the question is about how would we approach teaching? And this is a school committee debate. So we sort of think about this from a policy point of view. We look at the DESE frameworks. What I was thinking as you asked the question, and I was listening to some of the comments, where my mind goes is really to the environment in the school and in the classroom. It's not just about what's taught, it's the attitudes in the room among parents and teachers. When I first ran for school committee back in 2010, the term microaggression wasn't even in my mind. I had to sort of ask what that was. And I'm not embarrassed to say that, but that wasn't my sort of frame of reference. We talk a lot now in the district about how folks from different sort of races, cultures, backgrounds react to what they see and hear in the classroom. And some of those conversations have been really impactful, really authentic. I had the opportunity with our assistant superintendent of schools recently to reach out to a graduate whose parent had contacted the school committee with some concerns on this issue. And it meant a lot for me to hear that directly from the mouth of the student. And so I suppose that the best I could say is really we need to be careful that students have an opportunity to express themselves and give some feedback, whether that's through the administration or to the school committee on a policy level. I want safe places and safe classrooms for these conversations.
Thank you. The next question, the order will be.
Could I ask for a rebuttal?
Yes, you may.
Just very briefly, and it's just basically a final remark. And just reiterating that we do need to have a safe and respectful classroom for our children, because we're really teaching, or our teachers are really teaching our children to be ready for the real world. And being able to have conversations with people with different viewpoints is an important skill to be ready for our 21st century working environment and for the global economy.
Thank you. Would either other candidate wish to rebut? If not, we'll move on to the next question.
I'd just like to add that, you know, there's always a fine line with when the teachers are leading the discussions and things, and I think we're onto something. We want to have that diversity of thought, so when people talk, and I'm talking about the students, if the teacher is using is framing this in a way that the student doesn't feel comfortable, the way that the power structure is in the classroom is the teacher is if they're talking about things in one of the science classes or something, and the students can get a poor grade, they're really not going to be. I've heard it from my own children, and I've also heard it in the greater community from the teachers and the students, and from some of the administrators. So we got to be careful that make sure that we keep it so it's fair to all people. Thank you.
Thank you. Okay, we will move on to the next question. And the order will be Karen, Chris, and John. What is the role of the school committee in planning the curriculum? Do you think this includes insertion or removal of any specific material from the library or the curriculum? Karen.
So what is the role of the school committee in determining curriculum? And then is this, and also whether or not it includes removing materials from the library?
Or including materials.
Or including. So, so according to our policy, it's really the administration who is in charge of making curriculum decisions. And I would say one of our biggest strengths is our educators in the district, and we also have one of the largest professional development programs of any district in the area. Our teachers are learners, and they are teachers of other teachers. And with respect to, and we have in place, or our administration has expressed that one of our goals is a thoughtful program review. So we use data from multiple sources, school committee, to evaluate our programs and see what exactly we need to improve, and that will help to guide our efforts.
Thank you. Next, Chris.
So thank you for the question. I guess there's two ways to respond to this. The first is simply if you don't fund something, it doesn't happen. So there's certainly curriculum comes up at the budget table when we're either looking to introduce something we don't have, and sometimes we have to cut something and we wouldn't want to. That hasn't happened in a while, and when classes are cut, usually because we don't have the interest. However, since I've been on the school committee, we did establish a curriculum subcommittee. That subcommittee is established to foster a better understanding and oversight of the curriculum. That's pre-K through 12. The committee meets periodically with the superintendent and the assistant superintendent. They hear presentations by staff on major adoptions or revisions of curriculum, deletions or additions. Every year, the school committee does review the middle school and high school programs of study. Those documents also go funneled through the curriculum subcommittee where they have the opportunity to ask some really good questions. That subcommittee meets with directors and teachers as needed also to be informed on proposed changes in things like grading, homework, testing, the honor code, and so forth. There's also a responsibility to observe the progress of ongoing curriculum design. This is where the whole subject of curriculum mapping comes into place. But to be clear, that responsibility really does rely on the administration. So there's some shared responsibility here, but at the end of the day, that subcommittee comes back and reports to the school committee. And we've heard from them at least 4 or 5 times this year.
Thank you. And John?
Yes, okay, thank you for the question. I have the committee duties right in front of me here. Like I said, I'm the fresh eyes candidate with the open ears. And I would just add, so I'm looking at the school committee duties, and I think that was pointed out, there is a curriculum subcommittee. I've dialed into a few of them to get sort of a general sense of what's going on in those. I just, if I would add, the only other thing I would add to that is that if parents, we need to have that transparency with the parents to make sure that we hear them if they've got issues or they're just not hitting a brick wall. And my only put to that would be for some of the public school committee meetings, we really need to open these up so the parents are comfortable talking. We don't put a lot of like barriers in there, and it'll be better for transparency. It'll be better for all the parties involved. And I think, again, communication is leadership. And that's one area I would just point out I'd like to see improved where it comes to curriculum. Maybe there's answers for some things where they have concerns, but we need to respond. Thank you very much.
Thank you.
I have a quick rebuttal on that, Mary.
Yes, you may.
Just to, Mr. Dobbins just made an excellent point about making it comfortable for parents. The school committee tried something new a couple of years ago, which I frankly was a little uncomfortable with at first because we hadn't done it before. And that was this idea of office hours. They actually, I think, were pretty effective. Does not involve a full quorum of the committee. Parents can feel more comfortable in kind of a free-ranging back and forth conversation we don't have at the school committee table. So I'm hopeful once we get on the back of COVID here, we can maybe introduce those again. I think that could be an important opportunity for parents to use.
Thank you. Would either other candidate wish to rebut?
And
okay, I think let's take Karen first and then John.
I would just comment that for our parents, I do think it's important for parents to feel included. I think that our parents can reach out as well to their teachers, to their building principals, if they have students who are on an IEP. I believe that they can also reach out with their special education team, and of course they can always reach out to school committee members and talk to us.
Thank you. And John?
Yeah, just real quick, I think I'll third that. I would even offer that rather than doing the school committee meetings up at Parkhurst, we move it down to a location where people can easily, one, find it, two, change the format so we open up rather than just 20 minutes and sign-ins, and there's a lot going on, who's zooming in, who isn't, and maybe just having a little more informal. Let's sit down, we're all after the same thing here, and that's the excellent education, transparency, so that sometimes things start and then we think something's getting talked about that isn't, and I see I have to stop. Okay, we could talk.
Okay, we'll move on to the next question, and the order will be Chris, John, Karen. What do you see as the social and emotional impacts of the pandemic on students, and how should the school committee address these needs? Chris.
Well, there are many, and they're not just in the classroom, they're at home as well. And as is always the case, kids come to school even pre-pandemic with baggage from home that may not be our fault, but it's our problem. So I would say a few topics come to mind. Certainly one we hear from parents, concern about learning loss. One might also just say time lost on learning, since we had fewer hours last year and we had some barriers in place. So it's important for us to understand, well, I'll tell you what happened last year. So the administration really drilled down into being really clear, what is essential. I think we need to be very careful and thoughtful about understanding what the impacts are of time lost on learning, what plans are in place to sort of recover that where it's necessary. I'm going to say two other things, though, from a more positive frame. We saw some of our most reclusive, non-communicative kids pre-pandemic engaging over Zoom. When we went, and this was universally throughout the district, and there's some anecdotes that even adults have reacted this way in the workplace, that for some students being in the classroom surrounded by your peers, it's difficult to engage. But with the opportunity through Zoom, we saw some kids kind of in a different way than we had before. And our high school reps to the school committee, Charlie and Elle, they have been terrific in letting us know about some practices that were implemented during COVID that they'd actually like to see continue at Winchester High School. And I'd like to look at that district-wide as well.
Thank you. And Karen? No, John, I'm not going to make that mistake again.
Thank you. Okay, so there's a lot going on here. Talking to some of the teachers, really an eye opener on, and it's not everyone. Some handle these. Some of the students handle it better than others, and like was discussed, they're coming from different environments and everything else. And but the teachers are now grappling with this. Not only are they have to handle maybe the separation and then the masks. We got to get to that. The parents are dealing with this at home, so there's stress everywhere. We've had hybrid learning, and we do have to understand there's going to be another wave in November. Hopefully it's milder than Omicron, but we have to prepare now, not yesterday, not tomorrow, I mean, right now. And, as we look at, when I'm looking at some of this stuff, just being the fresh eyes candidate here, not here to be critical, but also knowing there is some COVID money. I've been talking with some of the town leadership that's available, and this is an area I think we could look. Maybe, I even have a call on with the state rep. Again, I'm not presuming anything. Maybe it'll go nowhere, but I plan to be involved, and I'd like to help out if things don't work out. And we're playing phone tag right now, but that COVID money that I think can be used to maybe mitigate some of this. But really, as the greater community has moved out of masks, if people feel vulnerable, wear your mask, do what you got to do. But man, the parents are crying out, and some of the students are acting out, and we need to address it now. Thank you very much.
Thank you. And Karen?
Thank you. So with respect to mental health, I think that the pandemic has been hard on all of us, on parents, students, our educators, our administrators. I think it was very hard it was hard at all levels of our school, of our students. For our young kids, I had a second grader when the pandemic started, and it was very hard having him at home and trying to keep him focused. And it's been hard with the isolation, I think, for our middle schoolers and our high schoolers. So definitely, I think we need to be very focused on their needs, and we have put into place supports to help them out as we are emerging from the pandemic, with respect to staffing, nursing, and with just social emotional programming for them. And with respect to the issue on learning loss, we have also been focused with our ARPA funding requests on requesting money to support tutoring, extended day and extended year academic supports and emotional support.
Thank you.
Mary, may I make a rebuttal?
All right, John first, then Christian.
Yes, and I just respectfully would like to ask the two incumbents where we are with the masks. And again, I'm not saying ban masks. I'm saying, options. I spoke at one of the committees, and I thought we'd have more progress than this. I know the kids are looking at the greater community and what's happening, whether it's on television, whether it's some type of award show, a sporting event. I mean, they see the restrictions lifted everywhere. In the last place that we're going to lift them are the Winchester school systems. What are the metrics we're looking for? Thank you very much.
Thank you. Chris?
So I appreciate John made that comment about what might happen in November. I hope he's wrong, but I'll bet he's right. I do think we're going to see a wave. I was the school committee member who in August of 20 made the motion to amend the back to school plan to formally engage with our public health resources on a regular basis. That was very successful. I can't say enough about them. So I would hope and expect that in anticipation of November, we do the same thing and we leverage our great resources in town.
Thank you. Karen, do you wish to make any comment?
With respect to masking, I am in support of optional masking, but I do think that this is something that needs to be worked through carefully with our within our district and with the planning and with the logistics around this.
Thank you. We'll move on to the next question. We'll have John, Karen, and then Chris. How can we increase resources or more effectively utilize those available to address issues of mental health and substance abuse among students? Please feel free to comment on funding sources. John.
Thank you very much. I did talk about this, but let's, for those that maybe are out there in WinCam land, right now, the way the funding works is from the state, we get about 20%. The town funds about 80%. Those numbers aren't perfect, so the federal government has about 5%. There's some circuit breaker funding they talk about. That's in the special ed, and there's some thresholds there, and then we get 70%. On the facility side, as I think Chris mentioned, the MSBA, depending on what happens there, 30 to 40% we're looking at. But what I want to key in on is that they call it ESSER or ARPA funding, but forget the acronym. Really, this is like the COVID relief from all the money that comes down. And there's a substantial amount of money there. It's not insignificant. It's about $6.8 million. And this is coming from my sources down at the town hall. And that money can be used in the things we're talking about with mental health and, not just the awareness, but like let's talk about. And I don't have all the answers to this, but I do feel like I'm a facilitator. I'm a trained problem solver, and this is all hands on deck right now. This has been identified both at for the state education department, but also I was listening on the Board of Health. They're all talking about it. Let's move out. The time's now. Thank you very much.
Karen.
Mary, could you repeat the question, please?
Yes. How can we increase resources or more effectively utilize those available to address issues of mental health and substance abuse among students? Please feel free to comment on funding sources.
Thank you very much. So with respect to funding sources for our for mental health, our budget is funded from our general fund and then also from circuit breaker and then also our budget is funded from this and from Chapter 70 funding. So we can for further support for mental health and for our students, we can seek help from the town from the American Rescue Plan Act with funding towards their mental health, towards extended day programs, toward extended year programs, and also for tutoring. So yes, and I would just say that when we are looking at our budgeting and how we prioritize, we look very seriously at what our administration how our administration has worked across the district with our leadership team in discussing priorities. And then I would say that school committee looks at that as well and thinks and reflects very deeply on that as well.
Thank you. And Chris.
Mary, thank you for the question. So when we talk about how we support mental health, identifying funding sources, or how can we use our money more effectively. So I would just make this observation: ESSER and ARPA are wonderful opportunities, but it's not a source of recurring revenue. This is one-time funding, and it's tremendous, but it's one-time funding. Mental health is not a one-time concern. Mental health is an ongoing concern. So it's a big lift for any municipal body, especially the school committee, to make an investment that's actually going to run the duration. So I point to, for instance, creating the Director of Health and Wellness position. It did not exist when I first was elected to school committee. Jason's now funded as part of the operating budget. I mean, there was a time when if there was a crisis in the classroom, a teacher supposedly could run to a principal or a school psychologist, but the odds were the school psychologist was tied up testing a student. So I feel like the district's done a good job in terms of making priorities for staffing. But we have to be very careful and fight hard for those investments that we think need to be long lasting, as opposed to, let's say, more of a momentary response in reaction to COVID. And then the other point I just might make is we can always look to be effective in what we do. We need to look at training teachers and staff, professional development. How do our teachers and our staff approach this topic in the classroom and in and among themselves, among their peers?
Thank you. I'm not going to take rebuttals for the rest of the questions because we only have about 2 questions worth of time left. You might want to consider any comments you would make in rebuttal as part of your closing statement. So the next question, the order will be Karen, Chris, John. The question is, why are so many parents dissatisfied about the current process for assessing and remediating reading challenges among younger students? How would you address both the program and communication with the parents? Karen.
So Winchester is a high-performing district with some of the strongest literacy scores in the state, but we definitely hear that there are families whose children have struggled with early literacy. And this is something that we definitely need to understand why. So even before parents were had raised these concerns, we were already asking for our special education director and the administration had already been asking had been seeking a program review of, for example, our language-based learning disability program over at the Vincent Owen School. Because if there is something that needs to be improved, then absolutely we want to improve upon it. So some of the actions that have been taken are our district has incorporated a kindergarten screener and is working on collecting data so that we can understand growth over time and then understand the trends over time. Our district is also offering professional development with a variety of strategies in reading so that our teachers have the flexibility to work with many students who have many different needs. Because just as we differentiate instruction, we need to differentiate our interventions.
Thank you. Okay, now Chris.
Thank you, Mary. I wish we had 20 minutes to talk about this. So this issue was sort of brought to the school committee as somewhat of a sledgehammer a little over a year ago by a group of parents who were terribly concerned. They were all, passionate and articulate. As we began to engage in some conversations, some of that happened at the office hours that I mentioned. What really struck me was that some of the concern is around screening. What tools are we using for screening? Are we screening? How frequently are we screening? What curriculum are we using? What is the scope of my child's IEP? My child doesn't have the right plan. Other parents are concerned that the IEPs that their kids have aren't being followed. This really strikes a chord with me. I have a child on the autism spectrum. I've had a kid on an IEP. I get this. But each of those concerns are very different concerns. Some of those speak to sort of policy and administrative issues around curriculum. Parents and kids have specific rights associated with IEPs. I met a parent at a hockey rink last year who was expressing frustration about his child's progress at McCall. And I asked what was in the IEP. He didn't know. And I told him what rights they have to sort of affect some change, and he wasn't aware of it. So we definitely need to work on communication. At the end of the day, parents need to advocate for their kids through our usual process. And when you hit a brick wall, you come to the committee and you can talk to us about your kid.
Thank you. And John?
Thank you. Yeah, all good points. I will say I'm meeting with the WinPAC folks on Tuesday. This is a hot button issue. And I appreciate Chris talking to his own personal experience. This affects my family members in town too. And there's no doubt about it, the pandemic has exacerbated this area too. So the tools and the priorities, things I talked about, the requirements, some of that money, I do want to circle back. We're talking about a $61 million budget for next year. And when we're talking about what some of the priorities are, whether it's healthcare or who suffered the most during this pandemic, and how can we fix that? And what are we focusing on? What are those priorities and where are we going? We're going to have inflationary pressures. There's going to be other pressures that come up that we don't know about. And then we're going to be back into a cycle in maybe 6-8 months from now, maybe 6 months. So how are we preparing for that? And are we doing the right things? Are we putting the focus on the children? $61 million budget. What are our priorities? And how are we strategizing now to make sure that the people that were most effective about this, the students I'm talking about, and how do we catch them back up and get them the help they need? Thank you very much.
Thank you. The next question, the order is going to be Chris, John, Karen. And the question is, how can we bring together people within the schools and the Winchester community at large who have differing points of view about the retirement of the Sachem school mascot and the return of the Winchester red and black?
How can we bring them
Chris
together? Mary, can you say that again? I'm not sure I followed the question.
How can we bring together people within the schools and the Winchester community at large who have differing points of view about the retirement of the Sachem school mascot and the return of the Winchester red and black?
Well, so just speaking from my own point of view, when the school committee made a decision last year on the retirement, I was very careful to say that for those who looked at that logo and the name and they think of it as the Sockham and they see it as a cultural appropriation and they're offended, I can respect that. But on the other hand, for those who look at the logo and they see a Sachem, and that brings great memories of championships, togetherness, camaraderie, community, growing up at Winchester High School, I respect that just as much. It's very much a personal issue with people. I was concerned at the time, not only with the cultural appropriation, but Mr. Donovan, who graduated from Winchester in 1977. I mean, this is really where I come down on it. He's a high school graduate. He's a professional graphic artist, and he has gone on record to say he hasn't given permission for his work to be used in the way that it was used. It was intended to be hung on a building, and that was it. So it was really a violation of his rights under VARA. And I felt I needed to be respectful of that as well. I also said that if students, and I think our policy says this, if students and others in the community want to wear the Sachem for what that means to them, they have every right to do that. And I'm not going to call anybody out for doing that. I respect that as well. In terms of bringing people together, I'm not sure. I guess I'd have to think about that a little bit more and understand where that would go or what the intent is behind that. People can always come to public comment. You can always write the school committee.
Thank you. And John.
Well, I think as community leaders, we need to focus on our communication and also building consensus. So in setting the example. So on something that comes up like the sachem, I grew up around that, and it didn't just come up in the last couple of years. This would come up every 5 or 10 years, and there was always a feeling of reverence for the indigenous people and the sachem and all the history that went there. It was never a subject of mockery. I will say this, that might be water under the bridge at this point, but I'm more concerned as we try to bring people together. When we have children now that go to school and they maybe hear about it from their parents or other people, or maybe other teachers, and then they go to their town teams and put the jersey on, it's sending the mixed signals that I think it's the lesson learned we can get from the school committee is build consensus before you do things. And if you communicate it right, people will be open-minded. If you ram things through and then expect everybody just to fall in line, you're gonna get the pushback that came with all of this. Thank you very much.
Thank you. And Karen.
So when we're working with, clearly school committee has many different constituencies, students, parents, guardians, the administration, and the staff. And I think one of the important things here is just listening to our constituents, asking questions, working together, building trust, and just collaborating. So with respect to this issue, I would say that all of that still is, those are just some of the key things that we need to do. And in other instances where we have worked with the community to listen and to understand their perspectives, and we understand that sometimes if things don't go exactly one's way, then it can be hurtful, or it can feel as if somebody's perspective has not been heard. But I think as long as the school committee and our administration are working together and really working to listen, then we can build a mutual agreement that is stronger in the long run for all.
Thank you. And this is the final question. And the order will be John, Karen, and Chris. You are welcome to use your full amount of time, but don't feel compelled to fill up time if you're finished. How should we address concerns about the safety of women and girls in the schools and as they go out into other private and public areas in our community? John.
Oh, I think that's a good question. Certainly, we want to make sure that our schools are safe, our community is safe. There's a lot of stakeholders in this process, and that includes law enforcement. I mean, as we tackled that question, I heard that with the Board of Health, and I couldn't help but think back to the horrible, horrible event at the Winchester Library, and then drilling back on some of the community concerns. So how do we work with all the stakeholders in the community where these problems, generally speaking, don't surface right on its head? If you look back, there's always a trail there. And how can we better work together where we can identify where there could be a problem? We know what's happened across the country in the schools. We definitely want to do everything we can to make sure nothing like that ever happens in this community, and especially with young girls. And we all know about the problems things can happen there, whether it's a community member or somebody's identifying it. All stakeholders, we need to think about how we do make sure Winchester's safe. We don't have any terrible events, because these children, especially these girls, they are our future. Thank you.
Thank you. Karen.
Thank you. So with respect to safety for our children and for girls, I would point to one aspect that we have looked at recently in policy is our bullying plan and bullying prevention and response plan. And the policy subcommittee took up this update recently. This is something that we have worked on with the community and with our WinPAC and with our parent association leaders to garner their input, just to understand the policy, or just to understand and update our policy around bullying, and where it takes place and how we treat it and how we respond to it, and how we can mitigate this. As far as other items, I would say that our schools are not fortresses. We can't have our students, we have to balance safety with not making our students and children afraid. So I would say that with the bullying prevention plan, and for students being able to report and be protected, that is the important thing.
Thank you. And Chris.
So I appreciate the responses from my colleagues here. I tend not to want to go to sort of personal anecdotes with my kids, but I'm going to share something and I hope I get through it. I'm not going to say which daughter this happened to. I have two. Once upon a time, one of my girls was terrified because at elementary school, a couple of boys came up to her and told her that they were going to follow her home, and they told her what they were going to do to her. She was terrified. I didn't hear about it from the district. I heard about it from her. It took her 4 days to tell me. And when I reached out to the teacher acknowledged it, said she had spoken to the principal. Let me say again, nobody called me. And she was a basket case, and I was ripped. But I really don't have any confidence that that's going to happen again, because present day, I am aware that girls in our schools, I mean, this may not be the case for all of them, but I am aware in many of our schools that girls feel comfortable. There's someone they can go talk to. They feel uncomfortable. Someone says something. And when those reports are made, I am acutely aware of the quick and disciplined follow-up and the communication to parents, all of which is governed by that policy that Karen just described. There are always opportunities to learn from mistakes. This is a great one. And we're in a better place today than we've been before, and we should always be open to opportunities to improve.
Thank you. It is now time for you to make your closing statements of up to 60 seconds each. We will start with Chris, followed by Karen, and then John. Chris.
Thank you, Mary. Thank you to the League. I'm exhausted of this pandemic and its real-world impact on instruction and learning. I appreciate the stress that we've all been under and our district's focus on mental health. But I'm also incredibly proud of the resiliency, the creativity, and overall positive attitude brought to bear in the face of such incredible change and uncertainty. I could not have imagined 3 years ago today that I would be working with an interim superintendent, an interim finance director, an interim town manager, 4/5 of a select board, and that 2 school committee members would serve only 1 term. Other key committees have seen similarly significant turnover, and with this, helpful perspective and institutional knowledge is lost. If elected, I will be the best mentor I can possibly be to help develop strong working relationships between the committee and other boards and departments. I respect and will continue to respect each and every member of our community. Though we surely don't agree on everything, respectful discourse is essential to good government. It would be an honor to serve Winchester for another 3 years.
Thank you. And Karen.
Thank you very much. We need experience now more than ever in the district. I have a proven track record of commitment to fiscal responsibility, diversity and inclusion, and also mental health. And with planning on the Lynch School rebuild and our district's expressed goals of long-term strategic visioning, and then helping students recover from the pandemic, the success of our students and our school system really depends on caring and informed leadership. So I hope that Winchester residents will consider my experience and vision and understanding of how to get things done in our school system as they are casting their ballots in this election year season. So thank you very much.
Thank you. Thank you. John.
Thank you to the league. Thank you to the other candidates for the spirited conversation. And I do want to address that mental health as a priority. We have a $61 million budget. We have some COVID relief money. We have lost 38 young people in the Winchester community in the last 10 years for other than natural causes. That cannot stand. It's the elephant in the room. We need to address it now. If you're a parent or a teacher or a voter out there that's concerned, I'll be your voice on this issue. Please vote for me. Now to Bilal. What's in it for you, Bilal? I'll tell you what. I would like to give you more snow days. I'd like to give you maybe some of the things you're thinking about, and that's okay. But what I can promise you this, just like I've had a wonderful career. I've traveled all over the world because of my foundational skills I got. I have a toolbox that allowed me to succeed. My promise to you is we're going to give you that toolbox in all your classmates, the middle school, the high school, the elementary school, so you can pursue your dreams and excel in any endeavor you want. Thank you very much.
Thank you. And thank you for participating in this debate. And we'll now go back to Lynn.
Thank you, candidates, for showing commitment to our community by running for public office and for participating in our debate. This debate can be viewed at WinCam on demand. Thank you to members of the public who rose to the occasion and sent us a lot of suggestions for debate questions. And I just want to thank our fabulous our fabulous moderator from Cape Cod, Mary O'Connor. And thank you to WinCam for producing this event. We thank the town clerk's office and the election workers for organizing a safe, orderly, and inclusive election. We here on screen gratefully acknowledge the contributions by a number of league volunteers who helped publicize, plan, and carry out this series of debates and related online information. And mostly, we thank you, the voters, for exercising your right to vote and have your voice heard. Please tune in to WinCam at the same time on Thursday, March 10th for the debates for seats on the Select Board and the Planning Board. Voting will be at Winchester High School from 7 a.m. to 8 p.m. on Saturday, March 19th. And thank you, everybody.